Hello, my name is Carl Cooper, and I'm the project manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability. And this is our presentation, Health Insurance Jeopardy, Round 2, Double Jeopardy, Part 3, Multiple Sclerosis. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it is the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say that when a consumer is looking at plans on the ACA marketplace, it is like playing a game of Health Insurance Jeopardy. I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. For our Double Jeopardy categories, we are looking at some of the disabilities covered in our population-specific fact sheets. And today we're going to be looking at multiple sclerosis. Our $400 clue: this is the type of specialist or doctor that diagnoses and treats MS. The question: what is a neurologist? And in this instance, you're going to want to make sure that the neurologist that they see or have seen in the past is in the network of providers for the plan that they're considering enrolling in. Now, it should be noted that the person with MS may end up treating on the long term primarily with their primary care doctor, but the neurologist is someone that they may want to return to, and in a given year, you need to find out if they plan on doing that when you're looking at whether or not that neurologist is in the plan provider network. The $800 clue: these are the tests used to help diagnose MS and are an important component of monitoring disease progression. The question: what are periodic magnetic resonance imaging, or MRIs? Of course, the importance with this is understanding the costs that these diagnostic tests can have and making sure that the individual is considering that when they're looking at the out-of-pocket costs in the plan that they're considering enrolling in. It may be a situation where if the person knows that they're going to have one of these more expensive tests done, that they may want to think about spending a little more in their monthly premium to significantly reduce their out-of-pocket costs. Moving on to the $1,200 clue. As of 2016, this is the number of drugs approved by the U.S. Food and Drug Administration which are available to reduce disease activity and disease progression for many people with relapsing forms of MS. The question: what is 13? And the $1,600 clue: of those 13 drugs, this is the number of MS disease-modifying therapies which are considered specialty pharmaceuticals. The question: what is all of them? And that's very important because, once again, when you're looking at prescription drugs and the way that the drug tiering is done, you need to make sure that the way that their tiering is set up and the out-of-pocket costs associated with that is not going to become too burdensome for the individual, and the person may want to think about another plan which doesn't have quite as many high out-of-pocket costs, even if it means paying a little bit more in their premium. Finally, the $2,000 clue: bladder problems, infections, bowel dysfunction, depression, dizziness and vertigo, emotional changes, fatigue, itching, pain, sexual dysfunction, spasticity, tremors, and walking difficulties. The question: what are common symptoms that patients with MS seek treatment for? And once again, as is with the case with most of these disabilities, it's not just the disability itself, but many times it's a lot of the co-occurring conditions that come up as a result of that. So they may not just need treatment for the disability, but also some of the co-occurring conditions that go along with that, and the treatments or medications or whatever that's going to be associated with those other problems that end up resulting because of the disability. If you haven't already seen it, be sure to check out round 1 of our Health Insurance Jeopardy presentation, where we address topics such as prescription drugs, medical devices, rehabilitation and habilitation therapies, Medicaid eligibility, the summary of benefits and coverage, and mental health. Those can be found on our YouTube channel at the link provided on this slide. If you're interested in finding out more about the NDNRC, you can check out our website, www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our channel to get more helpful videos like this one, And if you're interested in learning about the other disabilities listed, be sure to check out the links in the description below to access those videos. Thank you.